My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to DO or Do Not. If you are interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
On today's episode, we welcome Dr. Rebeccah Rodriguez, a Latin American trailblazer and an osteopathic physician who serves the United States Olympic and Paralympic Committee as a Team USA physician and was on the medical staff at the Olympic training site in Chula Vista, California as team physician for over 10 years. Dr. Rodriguez earned her medical degree from the ATSU-Kirksville College of Osteopathic Medicine and subsequently completed a family practice residency at John C. Lincoln Hospital in Phoenix, Arizona. She then did a sports medicine fellowship in San Diego Sports Medicine and Family Health Center in 2010, which opened up the door for her to work with the Olympic rugby team. Beyond her family and sports medicine practice, Dr. Rodriguez is passionate about improving quality healthcare. She helps make policy for national organizations such as the American Osteopathic Academy of Sports Medicine as second vice president, American College of Osteopathic Family Physicians California Board, Health and Wellness and Procedural Committee, and the President's Council for Sports, Fitness, and Nutrition. Dr. Rodriguez shares her views on osteopathic medicine, sports medicine, and how she felt as a woman going into sports medicine, a previously male-dominated field. We hope you enjoyed this episode.
Dr. Rodriguez, thank you so much for being with us today.
Thank you so much for having me. This is great.
We're really excited to have you. Dr. Wilson, I keep saying this, she's given me some awesome recommendations. And when I asked her for a list, you were at the top of the list.
Oh, that is amazing. She is so great and has been one of the inspiring physicians in my life over at KCOM and just wonderful. So I'm always so happy to interact with her and connect in any way.
Do you mind if I call you Becca for the interview, or Rebecca?
Yeah, that Becca's fine. Yeah, that's what everybody calls me.
Can you tell us, just as a little teaser, we're going to go into your journey, but can you tell me a little bit about your working with the Olympic team and some of the sports teams that you work with?
Yeah, so I'm honored to serve Team USA for the last 10 years, both at the Olympic Training Center down in Chula Vista, California, as a physician there once a week, seeing athletes. And those athletes could be anybody that is training for that season, that specific location. So there's 3 Olympic training centers, Colorado Springs, and then Lake Placid, and then the training site in Chula Vista. And then I also work with USA Rugby and also USA Women's Water Polo. So all have been just amazing experiences to be able to serve at that level in treatment of the athlete and being able to travel with Team USA to Pan American Games in Peru, of course, the Olympics in Rio 2016. And I was asked to go to the Paralympics in South Korea, but was unable to go at that time. So just really, really amazing experiences.
That is so cool. I think a lot of our listeners would think that that's a dream job, and we're definitely going to go into that a little more in a while. But can you start off by telling me what a normal day looks like for you? You know, just a general day, and again, a little bit about what your week looks like, even in general, starting when you wake up in the morning for your day.
Yeah, I mean, I think when I first wake up in the morning, you know, it's mom duties starting at 6 a.m. until about 9 a.m. And then either my husband or our nanny helps out with our son. And then I head over to clinic. And so clinic usually runs from about 9 a.m. to 3 p.m. And the beauty of family medicine and sports medicine is that there's a variety of cases usually on the schedule. So it's everything from a general physical to somebody that has shoulder or knee pain to a skin lesion removal to someone who's just coming in for basic osteopathic manipulative treatment for low back pain. So a lot of different cases throughout the day. And then basically throughout the week, we'll have a lot of the athletes that will call in. And so we just work them in according to the emergency of their injury. And you just make it happen. And I'm especially busy like December through June, because that's also our Major League Rugby season, which I'm the head team physician for San Diego Legion. So whether it be at practice or at game time, we're always seeing athletes. Usually on the weekend, that'll comprise a lot of sports activities. So I might be going from one game to the other or one event to the other. And so that's super fun as well. The events are definitely another level of excitement and focus than clinic. So it's really neat to be able to utilize all my skills for game time.
So Becca, I mean, it sounds so cool and so much fun. My only experience is my uncle was actually a team physician. And I remember going to some games with him, and he would have to evaluate the patients before and after the event. And then obviously an injury. Is that sort of what you do during the events?
Yeah, absolutely. So the medical team is a team. It's not just me. And so working with our athletic trainers, working with our physical therapist, who all have more training than just their degree, we go forth and put together an emergency action plan. We're connecting with the paramedics before the event, letting them know the different signs that we may do when assessing an athlete on the field in requiring their help. And then from there, yes, we're checking in with the athletes, with the athletic trainer. I'm checking in with any of the athletes that have certain injuries to make sure they were taken care of and getting them prepped for the game. And then we're on the sidelines. And so sideline is pretty intense, and especially for contact sports like rugby. You really have to have your A game and just every single sense just heightened to be able to pick up if someone gets hurt, if someone staggers from a hit, again, if someone goes down, if someone's limping after a play. So just really observing is key. And then, of course, recognizing when the athletic trainer can call you out on the field for an emergency. We're assessing on the field, on the sideline. We're also assessing, again, post-game, like your family member, and just making sure we get good follow-up care. Sometimes we're coordinating care with the paramedics. So we also have other team physicians that are helping out as well, specifically in rugby. I think that in the events of the games or when I'm traveling with like USA women's water polo, I'm the only person there besides the athletic trainer. So there's a lot more responsibility. And I think with travel to the different countries, you have to also become like a public health specialist in knowing everything there, from food, how it's cooked, the different insects, what bites people could sustain. Is there something specific like a certain virus or bacteria that people could get? So you really have to branch out past your education you get in medical school.
I would never have imagined any of those things. That sounds a lot more than what I would have envisioned. Becca, my other question for you is, it always seems like so much fun to have a job like that, but I guess sometimes there must be an injury during a game, maybe a very important player, and you have to make that call whether that person continues to play or gets pulled from the event. Is that stressful?
Yeah, and I think like the stress, I think, comes from assessing an athlete when there's a serious emergency. And so that is, for me, at least in contact sports, when somebody gets knocked out, when somebody sustains a concussion and loses consciousness. And it's making sure I hit all the protocol points for safety and care of the athlete, and coordinating care with the rest of the team to make sure they're covering their places as well. And the treatment for that, obviously, is that they're not going to play for the rest of the game. So that part is easy. But when I travel with teams, and again, like in water polo, if an athlete sustains a concussion and it is the championship game between USA and Australia in Australia, and you have to pull the captain from the game because of concussion symptoms, that's hard. But again, it's always making sure you have safety of the athlete, number one, and then two, looking at what are their career goals, what are the future games that they have coming up, how big is this event, how important it is to their journey in getting to the Olympics, and really just making sure you keep the athlete safe and do the correct treatment plan. So it's a little bit of stress, but I feel like the coaches I have worked with, athletic trainers I have worked with, everybody's been on the same page and wants the full safety of the athlete. So I've been lucky in that position.
That's obviously important that they're supporting your decision. We're just going to shift gears a little bit. And can you tell me where you grew up and what your family was like growing up? And if you remember when you first became interested in medicine and becoming a doctor?
Yes. So I grew up in Peoria, Arizona. And originally it was like a small farm town. And now there are many different sports teams and auditoriums and restaurants and stuff around the area. But yeah, grew up in a family of 5. So my mom and dad, and then I had a younger brother, and then my sister was the youngest. So I'm the oldest. And my family background is Hispanic. And so I had all the beauty of being around 100 cousins for Christmas, and same thing for Thanksgiving. We probably had less than 50 people at Thanksgiving. So when it was somebody's birthday, you could expect at least 40 people just in family.
Wow.
And so super close with my brother and sister, also my cousins, aunts and uncles, and just had a real good family support, not only for my immediate family, but aunts, uncles, godparents at all times in whatever I was doing, whether it be school sports, clubs, dance. I grew up dancing. My dad placed me in dance class when I was 3. And that was the activity that just took off and I excelled in, along with track and field. And so through dance, I was able to sign with an agency in LA and was able to start doing some television work from age 10 all the way to like 21 on different shows, and worked with different artists. And so it was just great environment. So I think dance made a huge impact in my life because it taught me a lot of characteristics I portray in everyday life, even a lot of the characteristics that I needed to have in order to get through medical school. And so that I loved dance. That was my passion. And so now, even in practice, I help out as company physician for the San Diego Ballet. And that's a really special connection for me, just having that background with dance and then being able to treat the dancers and help out and just help out the community. I think that my background, my strength, and different inspirations also come from my mom and dad. They have been wonderful, always positive, and always just saying like, let's sit down, let's make your goals. At the beginning of the year, mid-year, they would make time to go over them with us, how we're doing and achieving them. At the end of the year, we would also go over that and see what we needed to do or if I achieved them or not. And they did this with my brother and sister as well. And they've always been great in saying, go for the goal. Like, no dream is too big. And so whatever you want to do, let's put together a plan. Let's help you to get there and do it. So it was like nothing was ever too out there. It was always attainable. That was a really neat part growing up that, I always had in my head about different dreams that I did.
Did you decide that you wanted to go to medical school before you went to college?
Yeah. So I had kind of 3 areas that really continued to spark my interest in medicine. So first, my dad, he was a paramedic in the Air Force. And so he always had this black doctor's bag in his closet that had all the like tape and ace wraps, scissor. And what we would do, my brother and sister and I, is we'd always find ourselves in the closet and wrapping each other up in tape. And so that was always a fond memory I had about medicine. I thought just like wrapping people up with tape was so cool.
That's so cool.
And the second, was I had been asked to do a Disney show called For Our Children. It was a pediatric AIDS benefit concert for children with AIDS. And throughout that time, we actually had a doctor on set who was family medicine and sports medicine. And what was really unique is that he not only used to ask us on set if we were doing okay, if, we had any injuries, if anything that he could help with, but we also saw him go around and treat and talk with the children with AIDS, because they would sometimes be at our rehearsals to watch us. And so that always stuck in my mind on what a neat job that was, to be able to help people. And so I always kind of had that in the back of my head, but I was still pursuing professional dance. And then when I had to make a decision in high school to accept academic scholarships to college or move to LA and just continue to audition and be on TV, I chose to go to college. And it was a perfect pathway because I got into a program called Student Health Advocates on campus. I attended Grand Canyon University in Phoenix, Arizona. And there I got to meet Dr. Craig Phelps, who is actually now the president of AT-Still University. So at that time, he was the team physician for Grand Canyon, and I was also a college cheerleader and in this health program. And so I got to shadow him and just see what he was able to do and help athletes. And I shadowed him at his clinic and got to see hands-on approach to medicine, OMT, sports injury assessment. And I just thought, this is it. This is what I'm supposed to do. I want to be exactly like him.
That's really cool. I think a lot of doctors have a similar story. They like hook up with a mentor and that really changes the direction or the path of their journey. Can you tell me, was he the one that inspired you, I would guess, to go to osteopathic school? Did you apply to other programs? How did you decide you wanted to go to Kirksville?
Yes. So during college, he was the main factor to inspiring me to go the osteopathic medicine route. I did do neurosurgery pain research. I shadowed a MD, neurosurgeon, nephrologist as well. But over at Dr. Phelps' office, it was the most exciting and the most special. And I also got to see the medical students come through his office from Kirksville and rotate with him, and also thought they were amazing and said, if I want to be great, this is the pathway I need to go. And I really liked the hands-on approach to medicine with OMT. I felt like it was a great connection to dance, because in dance, there is a big emphasis on posture and technique and alignment. And so I'm used to having people kind of fix me in the right position to make sure that I'm having the right technique to do the certain move. And I felt like that alignment and that idea with improving alignment to have normal function was also there with osteopathic medicine, and he did it. And so that connection for me was awesome. So I think that the whole route with going osteopathic medicine from my education all the way up through fellowship was definitely because of Dr. Phelps.
Okay, Becca. So then you went to AT-Still, you trained as an osteopathic physician. How did you decide on family medicine? And did you know that you wanted to do a sports fellowship at that point?
Yeah. So pretty much when I got into school, and I applied only to osteopathic medical schools and only one MD school at the U of A, and nicely got into all of them. But Kirksville was the one I was going to go to because Dr. Phelps was there. And so, yeah, I mean, I just think that going through school, I knew right at the beginning that I wanted to do family medicine and sports medicine. So just integrating in with the family medicine club, the student association for ACOFP, and then sports medicine was a no-brainer and just fit. Everything was just really smooth in those two aspects.
So Rebeccah, can you tell me where you did your residency, what the application process for that was like, and the same for the fellowship?
Yes. So I went to residency over at John C. Lincoln Hospital in Phoenix, Arizona for family medicine, and they accepted 4 residents a year. It was a pretty competitive process. I remember they had like over 100 applicants for those 4 spots. And I wanted to get back home to Phoenix because I was in Missouri for those first couple years and just wanted to get back home to be around my family. And it ended up working out really nice. At Kirksville, we have a match. And so when we have a match for 3rd and 4th year rotations, so we did the match, and one of the states was Arizona. So I was able to go back 3rd and 4th year to do rotations in Arizona, and then making those connections again back for residency helped out a lot. So then completed my residency. With the fellowship, it was through San Diego Sports Medicine in San Diego. And again, recommended highly by Dr. Phelps for a great group of colleagues and just an awesome experience, a lot of hands-on experience. That also was very competitive. And I think at that time they maybe had, 60 to 80 people for one spot.
Wow.
And so that was probably the most competitive, but again, being able to do some rotations there and see the program, interact with the different DOs that were there and MDs was really great. And it seemed like it was a great program to have event coverage and just really get your feet wet in sports medicine, but also have that important academic part, because we partnered with UCSD for didactics once a week, all the fellows. So that was both that academic and then event coverage connection.
So you finish your residency, you get this very competitive fellowship, you finish, and now you're looking for a job. Did you know that you wanted to stay in California at that point, or what was the process like finding a job?
Yeah, so the very fortunate thing that happened was the same group I did fellowship with happened to be looking for a female physician in the practice right when I was in the middle of fellowship. And also to help with coverage over at the Olympic Training Center in Chula Vista. And so, as it had been always my dream to work with the Olympic athletes, this was an amazing opportunity I couldn't pass up. So discussing that time with my fiance, now husband, in different choices I had, that was amazing. And so I also had a job offer back in Arizona, but it was going to be where I was limited in not being able to do OMT because there was a chiropractor affiliated with the group. And then there were a couple of the family medicine physicians that really specialized in areas. So one did in like endocrine and like diabetes, and then another one did with skin. So I think the expectation was that I would refer those types of cases over. And I kind of felt like I was already being limited right at the beginning. And for me, I wanted to continue to do everything. And I think that the position in San Diego was able to allow me to do that and grow and continue to finesse and hone my skills, along with the connection to team coverage. So with lots of discussion with family and also my fiance, we all decided San Diego was going to be the choice.
First of all, that job sounds amazing. That sounds like a perfect job, no brainer. But did the group know about osteopathic medicine before you came? And how open are the athletes to OMT? Do they even know what that is?
Yeah. So the group that I joined was about 50% DOs and 50% MDs. So I think everybody had a great grasp on osteopathic medical education. Our fellowship director obviously was a DO. And so there were the DOs in the practice that all did OMT. MDs in the practice were wanting to learn OMT. So I think there was a great collegiality there, just about osteopathic medicine and the respect for it. When I went over to the Olympic Training Center in Chula Vista, the athletes just knew it by manipulation, or I just need alignment. But I think that since they were so used to working with chiropractors on a regular basis, and at that time, the chief medical officer over all the Olympic training centers, it was a chiropractor. I think that most of the athletes knew that improvement in alignment helped their function. And so they knew there were certain chiropractors, but then when I came along and they knew that I could perform techniques, they were very accepting, very excited. And I collaborated care with the chiropractors because they're there on a day-to-day basis and I'm only there like once a week. So a lot of it was getting comfortable with the techniques they do, them learning what I do and in my assessment. And again, at that level, everybody is so respectful of each other's skills, and the collaboration of care was really, really neat.
That's great. That it really sounds like everything comes together and best care for your patients, right? So yeah. If you don't mind, just a little personal questions. Is your husband a physician or is he in the medical profession?
No, he's actually captain for Oceanside Fire Department here and also has his master's in emergency management and administration. And so he deals with a lot of traumas and fires and things like that. But so we have like some connection on certain ACLS measures and topics there.
Is it hard? I mean, I can't even imagine. So he has his sort of emergencies and you're with these sports teams and traveling, and you told me you have a 2.5-year-old child. I mean, is it really hard to balance all these things, like his career, your career, and having a baby?
Yeah, I mean, I'm not gonna lie, it's work all the way around. But before our son, I would just travel with the teams by myself. Sometimes my husband John would come along to the trips and just kind of have his own adventure because he knows it's like a 14 to 16 hour commitment with the team per day when we're out on travel. And so he was good about having his own day and plans and doing his own thing. When our son came into the picture, then we actually brought him along. So he got to go to a couple of the different countries with us, Australia and Peru. And my husband was amazing to be able to be the caregiver for our son as I worked with the team. And then I saw them kind of sporadically throughout the day when we had some downtime with the team. But it's a lot of juggling of the schedule and just a lot of planning, but we definitely have made it work. So just good teamwork.
I think that's always what it comes down to, right? Just divide and conquer. Becca, can I ask you, being a woman physician and in sports medicine, was that challenging or do you think it was more difficult?
No, that's a great question. And we also discussed this with our Student Association for Sports Medicine of the AOASM. The same question about, female physician in kind of like a man's world of sports medicine. And I really had no prejudices or any type of abnormal treatment. I feel like the group of sports medicine, male or female, have always been embracing to teach and include each other. And what has been great is that you might have a physician that is team physician for like the WWE. I think it's called something different now. and they send you a patient from, Philadelphia or Atlanta all the way to San Diego, and saying like, and you may have met them or maybe not, but just being a part of the AOASM, they see your name and help make that connection to send athletes. And so that's been pretty neat to have that interconnection all throughout the United States, to have different athletes see different DOs in sports medicine. And again, no real issues. Sometimes it's funny to have like the patients come in and know that I'm head team physician of Major League Rugby, and they kind of like, oh, you are, like a little like surprised. And so I think that's the only maybe funny expressions that I get. But other than that, everybody's been so welcoming. So I've been, again, very fortunate.
Yeah, that's awesome. That's really good to hear. We hear a lot of tough stories. So sometimes when when people are just judging you for your skill set, that makes you feel good that things are the way they should be. Becca, one question from one of the videos that I watched. I think you mentioned that you didn't know Spanish, that you didn't speak Spanish growing up, and then you picked up Spanish later. Is that right?
Yeah. So, growing up, my parents both spoke Spanish, but they didn't speak to us fluently for my brother and sister and I to learn. And so even at family parties, aunts and uncles and cousins would speak Spanglish, like we say. So everything was kind of just like disjointed, and you'll pick up some words and things like that, especially the cuss words probably. And so anyway, with that, then I just made it a point to take Spanish in high school. I minored in it in college, and then I was able to teach medical Spanish to Midwestern Medical School over in Arizona, so ASCOM, to their first year class, and just really made an effort to have a tutor every once in a while, again, just to keep Spanish fresh. My husband and I, since we like to travel, make it a point to go to Latin American countries or even trips down to Mexico, so just we can immerse in the culture and the language and be able to speak. And my husband also did an immersion program in Venezuela to speak Spanish. And so it was a goal of ours to also raise our child with being bilingual, because neither one of us really had that growing up and learned through school. So that it's been a learning process for sure to put everything together, and you just got to keep brushing up on it, because if you don't use it, you lose that skill.
Right. I find, I bring that up because I trained at University of Miami. And, when I was interviewed, I talked a little bit about how my GI education was great, but the immersion in the Latin culture while I was there was so important. And learning Spanish has been something that I've used throughout the years, and I'm sure you find the same.
Yeah, absolutely. And like you said, being in a city where there's a high prevalence of Spanish speakers, I mean, it only gives you a huge benefit to be able to communicate, your evaluation, treatment plan, have that connection where they come back to you. And so I definitely see that here in San Diego with some of my patients too, as they are, Spanish speakers only. Yeah.
That's great. Rebeccah, one question that I have is always that there are different pathways, if I'm not mistaken, to go into sports medicine, like orthopedics, internal medicine, family practice. If you had to give someone advice on pathway to a career, let's say a student is listening and they're like, wow, this woman's amazing. I want to do sports medicine. That is the coolest thing ever. What advice would you give them for sports medicine in general, and then specifically for residency to start off?
So I think it's probably best to kind of step back and evaluate like what really is their passion. And so if it is to treat at high school level, if it is to do sports medicine at the elite and professional level, what skill set do you want to bring? So again, I think like with emergency medicine and family medicine, you get a variety of skill set, treating basic coughs and colds and being able to treat like female health. But again, you have your sports medicine skills that you're going to bring to take care of the team. I think that like looking at internal medicine, that's also a great area. You might just have to study up a little bit more on female athlete health. The other pathway with physical medicine and rehabilitation is also a wonderful musculoskeletal component. And so the strengths may be with the Paralympians, people with prosthetics. There also might be having to brush up on more basic general medicine type of cases, like treating a sinus infection or like recognizing a fungal infection. So I think any area is very good in getting to sports medicine, but you just got to look at what type of skill set you want to be able to bring to the team. I think that family medicine helps to bring the most variety of skills, and you tend to know a little bit about a lot that can help bring more care to the team. So yeah, I mean, any area is good, but I think just looking back at what type of skill set do you want to bring? Is there a certain sport that you want to treat? There's often ER sports medicine doctors that help out with a lot of contact sports. And so that's great because they have that level of intensity and emergency, both when they're in the ER versus when they're on the field with these athletes. So yeah, I just got to look at the sport and what skill set that you want to bring.
I think there's no question from the family practice doctors that we've interviewed in general, the fund of knowledge and the breadth of knowledge is, you can't beat it with any individual specialty. So I see how that's a huge benefit.
Yes, with the Pan American or like the Olympic Games, you see a lot of family and sports medicine physicians there. And so again, I think at that level, there's just a lot of skill set that specialty brings. That's it.
Rebeccah, thank you so much for spending time with us. I really appreciate it. And I know our listeners are going to be so excited at, having you on and listening to your journey and your experience. So our grand finale, our last question is, what is the best piece of advice that you were given from somebody else, whether it be in grade school, in college, from your parents, during residency, or even as an attending, that you would share with students and with our listeners that you think gave the most value to you and you think would be great to pass on to them?
Ooh, that's a good one. Yeah, lots of great people have given me advice.
We'll take more than one.
I think one of the best pieces of advice I received was from a neurology DO back at Kirksville. And he really emphasized in our class, take time to listen. I think that with medicine, as it is ever changing and so fast moving, maybe even the stress of some specialties having to see patients in quicker amount of times, that is lost. So take time to listen to the patient because they will tell you the answer. If you don't listen and you just quickly make your assessment and add your differential diagnosis, and then I think that you can miss the real diagnosis there. And don't be afraid to ask for help from colleagues. I think that so often maybe there's a pressure to come up with the answer very quickly and initiate the treatment plan. And sometimes that might be blurry and you might need to phone a friend, call some of your classmates or a colleague nearby to really make sure that you're giving the best care for your patient. And then I think throughout the years in practice, don't lose your OMT skills. Whatever specialty you choose, some way, somewhere down the line, those OMT skills are going to come into play. And so I think don't lose that connection because it just adds a lot of skill set to your doctor's bag and also helping both in aiding in diagnosis and for your treatment. And I think the last piece of advice would just be what my dad has always told me is that if you have a dream and you have a goal that you want to do, be ready to work hard for it and surround yourself with a good support system, but it is attainable. And so just being able to put that into action in order to achieve your great dream. So yeah, I think keep working hard.
Yeah. Thank you, Rebeccah. That is awesome. All of the advice is awesome. Thank you so much for spending time with us. Dr. Wilson never disappoints. I mean, you've been great and I think very inspiring.
Well, thank you. It's been an honor to be on. And again, I've listened to the podcast and saw the different physicians, specialties that have been on, and just an honor to be interviewed. So thank you so much for your time and what you're doing to help out, inspire our students and residents with osteopathic medicine.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there is someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.